Welcome to This Explainer. Today we're tackling something that millions of people go through. But honestly, very few actually understand it. We're talking about panic attacks. We're going to break down the intense, physical reality of these episodes using some really fascinating clinical insights. We'll explore exactly why they happen, how they manage to completely trick your brain, and most importantly, how you can step out of the fear and take your power back. All right, let's get into it.
So picture this. You're just sitting there, totally safe, minding your own business, and then boom! Out of nowhere, you're hit with this absolutely crushing sense of doom. Have you ever felt that? Well, clinical psychologists define anxiety precisely in this way. It is, fundamentally, an illogical fear. It's a state where you become utterly terrified without any real-world danger actually being there. Your brain sounds a massive alarm, but there's absolutely no fire. At its very core, anxiety is basically a massive trick played by your own mind. But it's really important to differentiate how this trick plays out. Generalized anxiety, that's kind of like a constant, low-level background hum of worry. Social anxiety is highly specific. It hits when you're doing a presentation or walking into a crowded party. But a panic attack, that is a sudden, extreme, and incredibly physical explosion of that illogical fear.
To get us from fear to empowerment today, here is our game plan. We'll cover what a panic attack actually is, the heart attack illusion, the fear of fear, triggers and root causes, grounding techniques, and finally, exactly how to help others.
All right, part 1. What exactly is a panic attack? Unlike that all-day background worry we just talked about, a panic attack is a sudden, violent onset of physical symptoms. Your brain thinks you're losing control or going crazy, and the mind-body connection just goes totally haywire. The initial illogical fear in your brain instantly triggers very real physical reactions. We're talking severe palpitations, where your heart literally feels like it's hammering right out of your chest. You might get sharp chest pains, start sweating profusely, or feel this terrifying numbness and tingling in your face and hands. You literally feel like you can't catch your breath. And then, because you feel all of this, your brain panics even more, and the whole thing just spirals. Now, if you're stuck in the middle of this storm, I know, it feels like it's going to last forever. But here's the reality check. A typical panic attack peaks and fully resolves within a 5 to 20-minute window. It's just a temporary burst. Quick side note, statistically speaking, women are affected by these almost 3 times as often as men. But no matter who you are, the absolute worst of the storm is usually over in under 20 minutes.
Moving on to part 2, the heart attack illusion.
This is arguably the scariest part. The physical symptoms, the chest pain, the lack of breath, they're so intense that they flawlessly mimic a full-blown heart attack. The illusion is incredibly convincing. People genuinely feel like the angel of death is standing right in the room with them. Naturally, they rush to the ER. Doctors constantly see patients walk in with these massive, thick medical files, tons of ECGs, lipid profiles, endless blood work, and guess what? Completely normal results. People will literally bounce around to 3 or 4 different doctors because they just refuse to believe their perfectly healthy organs are just anxious. There's even a clinical story of a patient who got a totally clean bill of health, stood up to leave, and then begged the doctor to run every single test just one more time. That is how powerful this illusion is. So if you take absolutely nothing else away from this explainer today, please burn this phrase into your brain. It is scary, but it's not dangerous. You've got to consciously train your mind to recognize that fact. Remind yourself that while the physical sensation is absolutely terrifying, it's a false alarm. It cannot actually kill you. Your mind is kind of like a magnet, right? If you just keep telling it over and over that this is a panic attack and not a heart attack, eventually it's going to listen.
Which brings us to part 3, the fear of fear.
Here's the trap. Once you survive a panic attack, your brain goes on high alert. You've got the actual attack on one side, that intense 5 to 20-minute burst. But on the other side, you have the aftermath. This constant, agonizing anticipation of when the next one is going to hit. You start obsessively checking your own pulse. Your heart beats just a tiny bit faster for a totally normal reason, and your brain screams, "Oh no, here it comes again." That anticipation actually morphs into its own disorder. You end up trapped in this restless loop where you aren't just afraid of the world around you, you're literally terrified of the fear itself.
All right, part 4, triggers and root causes.
So why does this happen? A panic attack can feel like it strikes completely out of the blue, like you're just picking out tomatoes at the grocery store. But usually there's something much deeper going on. Experts point to a few big culprits. Major life stressors, like a painful divorce or a bad breakup, can completely fry your nervous system. Severe illnesses or accidents are huge factors too. Also, childhood abuse, whether that's physical, emotional, or sexual, leaves a very real, lasting imprint on how your brain processes fear. Throw in a genetic family history of anxiety or just a natural tendency to hold on to negative emotions, and you've basically got a heightened vulnerability to these intense emotional responses.
It's also super important to understand how different triggers actually work. Take agoraphobia, for example. This makes people avoid places where they feel trapped, like a packed elevator or a crowded mall. The fear is all about not being able to escape if an attack hits. Trauma triggers, on the other hand, are tied directly to memory. So someone might completely refuse to ever set foot in a specific hospital because a loved one passed away there. To tackle those trauma triggers, clinicians use something called exposure and response prevention therapy, or ERP. Basically, with professional support, a person slowly and safely visits that location over and over until the brain finally unlearns that intense fear response.
Okay, let's talk solutions in Part 5, grounding and coping techniques. Look, you can't just flip a switch and turn off fear in your brain. Sure, you can lower your overall baseline anxiety with good sleep, working out, or journaling. But what do you do right in the exact second an attack hits? Step 1, absolutely prioritize deep breathing. You want to inhale deeply through the nose, hold it for about 3 to 4 seconds, and then exhale super slowly through your mouth. This is your immediate physical counterattack. It gets the blood flowing, opens the lungs, and literally sends a biological signal to your nervous system saying, hey, stand down. This is the mandatory first step right before you try anything else.
Once you've got your breathing just a little bit more under control, you bring in the 5-4-3-2-1 method. Imagine doing this next time you feel overwhelmed. It's a brilliant mindfulness trick. You look around and say out loud 5 things you can see. Then, reach out and actually touch 4 things. Feel the texture of your shirt, touch a cold table. Next, listen closely for 3 specific sounds in the room. Sniff around for 2 things you can smell. And finally, 1 thing you can taste, even if you just pop a piece of candy in your mouth. What this does is incredible. By forcing all 5 of your senses into action, you purposefully yank your brain out of its internal panic loop and anchor it right back into the very real, very safe physical environment.
And finally, Part 6, how to help others. If you're ever with someone who's having a panic attack, how you react is everything. Sadly, most people accidentally say the exact wrong thing. Telling someone, hey, you're just overthinking, chill out, it's no big deal, is incredibly damaging. Experts say that entirely dismissing their terrifying reality feels like a punch to the gut. Instead, try saying, I can understand you. I know this is scary, but you are safe. Giving them that deep empathy and actually acknowledging that their physical fear is real, that acts as a biological cue to calm their frantic nervous system. Keep these steps as a mental flashcard for the future. If someone you love is panicking, just ask them what they need. Ask if they want you to stay right there with them. Sometimes people need space, but a lot of times they're terrified of being alone. Reassure them. Tell them, I am not leaving until you are comfortable. Ask, can I hold you? And if they're too far gone to remember their coping tools, gently do the deep breathing exercises with them. You are acting as their anchor for those 5 to 20 minutes until the storm safely passes.
We've unpacked the illusions, the root causes, and the real-world tools you need to break this vicious cycle. So I want to leave you with this provocative thought. Next time anxiety strikes, whether it's happening to you or someone sitting right next to you, will you remember the core truth? Will you remember that yes, it is incredibly scary, but fundamentally, it is not dangerous? Truly understanding that difference, that is the very first step toward taking your life back. Thanks for joining me on this explainer, and keep empowering yourself with knowledge.